Thank you, Scott. Yesterday, we told you about a frustrated mom-to-be whose husband said that he was experiencing morning sickness during her pregnancy. Apparently, it's a real thing, and it's called Couvade Syndrome.
Typical men making it all about us when our wives are the ones suffering. But it's kind of it's a thing. It's a condition when expectant fathers experience the same symptoms and behavior as their pregnant partner. Some men reportedly gain weight, while others complain of heartburn, toothaches, and more. It's not something we hear about, a lot because it's kind of a phenomenon. But is this real or is this in our minds, us dads? Dr. Vincenzo Berghella is an OB/GYN, director of maternal fetal medicine at Thomas Jefferson University Hospital. Hey, doctor.
Hi, Jason. Hi, Alex. Thanks for having me.
So is this a medical thing or a psychological thing?
So first of all, it's not really a psychiatric thing. Let me say that 99% of that tension in pregnancy should be for the woman, but it is a real thing in terms of fathers to be experiencing some of the symptoms that you described of pregnancy, probably because of the stress and the responsibility of the pregnancy.
So that's why it happens? It's just you're anticipating what's all about to happen and seeing your wife or your partner go through what they're going through?
Yeah, if you have kids, your life changes completely. And so you feel the stress of having to care for the wife, feeling, or the partner, feeling her changes. You kind of participate with her pregnancy. In fact, some studies say that the more you're involved in the pregnancy, the more you feel some of the nausea, the stress, the insomnia, and some of the other symptoms.
Well, yeah, you're kind of going through it with your wife, right? You're living it with her, but at the same time, feeling it. That's a whole different thing. And I know you've had, in your previous children, doctor, you've felt it with your wife.
Yeah, I definitely felt it. You had the responsibility, which is, economical, the house, what schools are going to go. And, during the pregnancy also, how is the birth going to be? Is she going to be okay? And, you see her eating maybe a little bit more. Maybe that's why some people gain weight. It's more difficult to sleep. You're sleeping next to her. Maybe that's why it's more difficult to sleep. It's a participation thing. I think, in a way, I take it as a positive thing that the father, the partner is involved in the pregnancy, which is really a huge change for the woman. And again, the woman, I think, should get all the sympathy and the support.
We got to say
switch it to the dads at all. But they should be looked at, for a couple seconds during those visits, make sure that they're okay as well.
Now that I think about it, though, I've had 5 kids, and I didn't feel the morning sickness, but I think I gained weight. You're eating alongside your wife, and so you go through it with her in that respect. So I get the weight gain part for sure.
But when it comes to the men, they don't have to be treated, even though they have an official name for this, Couvade Syndrome. It's not an actual condition, is it?
No, it's not an actual condition. I think it's really, really important that you emphasize that, Alex, is not listed as psychiatric, a psychological condition. Just something that happens. It doesn't need to be cured or anything. But it's a nice thing for the father to participate in the pregnancy, to show support. In fact, in ancient times, people say that fathers would do it to kind of prove that this was their baby,
Wow.
This has been described, since
deep.
Egypt and Rome, etc., thousands of years ago. And some of it was, before dads were even less certain that they may be today. And this was one of the ways for the father to say, hey, look, this is my wife, my partner is going to be my baby. I'm, quote unquote, suffering some of the pregnancy things because this is mine and I'm participating in the pregnancy myself.
Well, I'm glad, doctor, that you're giving us the history and all that, because I imagine a lot of pregnant women and moms are rolling their eyes.
Oh, totally.
Or at least really, come on, we're the ones actually going through it.
And they should in some ways. They again, 99% of the attention should be to them. I'm an obstetrician, and the women really have the major changes. Men's very little.
I can hear my wife saying, please. Dr. Berghella, thank you very much.
Yes, thank you.
Thanks for having me, Jason. Bye, Alex.